Please welcome Professor Dr. M.Moin.
Assalamu alaikum everyone. Thank you very much all the organizers for organizing this event. I think especially thankful for team and COVS in which we have Dr. Arif, Dr. Salman Hamza, all the Dr. Aisha, Ms. Aisha Salim, Aisha Sarfraz, Tehsina is here. I think all the people who are sitting in the front seat, they have done a wonderful effort, and thank all the students of COVS for attending this session. I feel very proud that we are holding this session and everybody is attending, and we are really thankful to the Minister, Dr. Jamal Nasir, that he has spared his time. He is scheduled for a meeting at the Secretariat at the moment, but he's especially given us time, and Professor Asad Aslam Khan for giving his valuable comments and giving an idea and overview of how he has changed the blindness rate in Pakistan through his development of human resource and the collaboration with NGOs and resource management through. That's an excellent effort of how you can do and promote your country and your people in Pakistan. And thankful to Professor Harun Hamid, Mr. Farooq Awan, Dr. Suhail Sarwar, Professor Suhail Sarwar, Dr. Raza Ali Shah, and Aliya Sadiq. My aim, I think the 5 diseases, if you go in and look at the International Blindness Survey, the first one I think is refractive errors, and that was very nicely shown in the skit we had initially. That is something which is very prevalent, and I must acknowledge the role of NGOs to bringing that service to the grassroots level through the inclusive eye health program. And then we have got other diseases like cataract, which comes under number 2. Then you've got glaucoma, then you've got diabetic retinopathy. Those are the main diseases which we work on. This is a small disease I want to talk about today, just to bring, to highlight this disease, because this is something which is coming and bracing Pakistan as an epidemic. I was I gave the Holmes International Medal Lecture at the APAO conference on this, and I was given the award for doing work on this. And this is something which is a baby which we have who's born premature. And the problem which you can get in these babies, that these babies, although a lot of effort is spent on saving them from their life, that you spend, bacha aata hai, he's very sick, he keeps in the ventilator, the pediatricians, the neonatologists work very hard with him, and by the time he's discharged, they don't know that there's another disease which is waiting for them and which can make them blind. And although the child may be very physically as a normal person, but if he's blind, this is a big responsibility and a burden on the society. So these premature burdens, if you just take a look at this picture, normally your temporal retina is not vascularized when you are born, but as soon as you are born, you get extra oxygen. And the main problem which you get is uncontrolled oxygen. Our Professor Harun Hamid is here. He'll talk more about it. That uncontrolled oxygen leads to stoppage of the blood vessels over here, and that makes a ridge, and that ridge will lead to the formation of new vessels, and that will lead either to the resolution of the disease, or 10% will have detachment of the retina at that level. And this thing is all happening in a baby who was born less than 35 weeks, and this starts happening at about 1 month after birth, and he can go easily blind if he's untreated within 2 months of his after his birth. And that becomes a very, very disastrous for the parents and for the child as such. The child doesn't know what he's going through, but the parents go through a lot of emotional distress, and they feel that when we find what were the causes that the patient did not know that this disease was going to affect them, we found out that there was lack of information given to the children, to the parents of the children, that you need to get screening from an ophthalmologist. So the main focus is to raise awareness about this disease, and once you raise awareness of the disease, you will have more children coming to ophthalmology units, but other ophthalmology units prepare to deal with a huge burden of premature babies. why do we say that this is the epidemic of ROP? The first epidemic happened in the 1940s in the USA with high oxygen being given to them, and that was called retrolental fibroplasia. The second epidemic was when in the 1990s in the Western world they found out that the babies were less than 28 weeks, 30 weeks who are surviving. Now internationally, children who are 25 weeks and less, they are surviving. So their blood vessels are very premature and they are exposed to oxygen. The main thing is now, why is the third epidemic coming? And this is not coming in the developed countries, it is coming in the middle income countries in which Pakistan also falls. And the reason is less birth weight babies are surviving at a lower gestational age, and they are being exposed to treatment modalities such as oxygen, which is not optimum and which is not there to control their disease. So when you talk in the West, they say we don't see that much of ROP. I said, why? Because our neonatologists are able to control them so well. But we are still in the phase that our neonatology services are expanding. The government, I think, is working very hard on it, and they're going to expand the neonatal services. In India, they've done a revamping, huge revamping of neonatal services in which blended oxygen is one of the major factors. Here you can see ROP is in the high income countries. It falls as a cause of blindness. Then Pakistan falls fourth in the number of babies who are preterm babies who are born in Pakistan, and this is a risk of blindness is in the middle, in the red zone in Pakistan, because our infant mortality rate is increasing. It was in 2013, it was 61, so that is the critical rate at which babies survive, and that leads to ROP. You can see Argentina is a very big country and probably much advanced than Pakistan, and they have a huge population of blind people because of ROP, because they did not hit the epidemic hard at that time when it was needed. That led to the population of so large number of babies with blind. So this is the epidemic which we are facing, and the reason is because they are not being referred enough to the ophthalmologists. Some centers in ophthalmology are not trained enough to handle this, and then babies are exposed to things like oxygen, which probably leads them to get more of ROP. So this is what is happening in Pakistan. So we initially started in 2015 with Dr. Umar Mia. He's a retina specialist in New York. Just an organization, ROP Propera, in which we aim to develop human resource, sort of educate people about the disease, improve the treatment across Pakistan. And if we take the burden of disease, the population of burden is 210 in Pakistan, out of which 6 million births per year. And Pakistan has an infant mortality rate better than 61, and the prematurity rate is 20%, is number 4 in the world. And the screening, initially in 2012, we had 2 centers for ROP screening. Now we have much more. 5% of premature babies born less than 35 weeks can go blind. So the 6 million births, 20% prematurity, 10% less than 35 weeks, out of which half will not survive, and 5% blindness without treatment. And we calculated if there's a child who's blind, how much the state or their parents have to spend for their lifelong support. If the average age is 60 years, then you can spend up to 6 million rupees on them. But if you screen the baby at time and you treat the baby in time, they will not be blind. So you can prevent that much of burden on the social, the economic burden of the government by just reducing, by preventing that disease that plays a very vital role. The other thing is, as we have seen in the recent epidemics of anti-VEGF, that there's a litigation is something which is upcoming in Pakistan. In the United States, people took care of this because this lawsuits of 23.8 million in USA. In India, there was a lawsuit for 500,000. So it is a high time that we address this situation. We've seen about 1,300 babies screened in LGH over the last 6-7 years, and The babies who were 216 which needed treatment. Out of these, there were some babies who had advanced disease like stage 4 and 5. So there are babies like 35 which were potentially going to go blind because of this, and we were able to save, I think, 20 out of them because we could do surgery, but they could all be prevented if we could have done surgery. And this is what the retina looks like. If you do not treat a baby, you just get a rod. The retina is just rolled like a cigarette paper, and you cannot see anything out of it, and the baby is blind. And we were studying the number of babies who came to us as blind. So we had 50 babies who came blind in over 2 years, and these were the diseases, these were the stages of the disease. So that shows that if there are 50 babies every 2 years in one center, so if you multiply by all of Pakistan, you might have 400, 500 babies across Pakistan going blind every year or every 2 years. So that's a big burden which probably needs to be addressed. For that, we need to develop guidelines for which we worked on, and the institutions in all initially were less, but now we've got a lot of more institutions which are doing ROP services across Pakistan, and we've developed a network doing this. And then these are some things which we've developed, like reading materials, patient education, information, a website on ROP. We've published a handbook of ROP for training. We've developed a database for recording their patient. And then this is the first ROP conference in 2018. Claire Gilbert, she works in the London School of Hygiene. She organized that through London School of Hygiene, and she's coming again in this December, and we're going to have an ROP conference over here at COVAS on the 7th of December, and we want to show her an initiative that over 5 years what we have done and what policies we have made through the government to improve on to work on this disease in this. And we also want to start a study which is a LAMROP, for which I would thank Professor Asad Aslam for arranging a RET cam for us, so we can take that mobile RET cam and go to different hospitals or different district hospitals and screen for babies of ROP, so they do not have to all to come over here. This is the National Task Force which was established in the term of Professor Asad Aslam, and we are working on developing a situational analysis, and with which government which we need a help is developing a situational analysis, knowing how many neonatal services are available in Punjab and across Pakistan, and how many neonates are being taken care of, and how many are potentially there which needs treatment. So accordingly, human resource can be developed. So there are problems with equipment, with other problems, so personnel, and special thanks to people over here. Dr. Lubna is sitting here. She worked with me quite a lot on this disease, and recently we had the World ROP Council. I was elected a member for that. And these are actually a picture. Last World Sight Day, we had a picture with all the babies who we had treated, and they were saved from going blind, and this was at LGH, and we celebrated World Sight Day with them last year. So over the last years, we have taken following initiative, but this is a catastrophic disease which needs to be addressed, and we're working hard, and we need support to work more and fight this disease. Thank you.